Good afternoon, everyone. My name is Deepak Madala, and I am with the Virginia Poverty Law Center. I manage the Enroll Virginia project. Enroll Virginia is a statewide program of legal aids and community based nonprofits throughout Virginia. We educate consumers about their health coverage options and also provide free application assistance to people who need our help. So today I'm joined by my colleagues Susan Nolan and Cassie Edner, both from the Legal Services of Northern Virginia, to discuss the new public charge rule that went into effect yesterday and how that will intersect with the various health coverage options that are currently available to immigrants in Virginia. Before we start today, I'd like to just provide an important disclaimer that the information that's going to be presented today is for informational purposes only, and that should not be construed as legal advice on any subject matter. We do recommend that if you are needing assistance with your particular situation, that you should consult with a licensed attorney for more information. So today's webinar, this is just a brief agenda of what we're going to discuss today. I'll go first. I'll be just giving a brief overview of the public charge rule itself that went into effect yesterday, what changed, and how it will be impacting immigrants in Virginia. Then Cassie Edner from Legal Services of Northern Virginia will go, and she'll provide an overview of Medicaid in Virginia and how immigrants can qualify for that program. And then that also includes Medicaid for children and Medicaid for pregnant women as well. And then finally, Susan Nolan will come on and provide an overview of the health insurance marketplace that's available at healthcare.gov. This is a program that many thousands of immigrants in Virginia have signed up for, and will provide an overview of that program as well, and how immigrants and other Virginians as well can qualify for that program. The new public charge rule went into effect yesterday on February 24th, 2020. As some of you may know, last year, the Department of Homeland Security finalized this public charge rule. This new rule was scheduled to take effect on October 15th, but multiple federal courts have issued injunctions that temporarily stop the rule from taking effect as scheduled. Last month, the U.S. Supreme Court lifted these injunctions, and the new rule went into effect yesterday for the entire country. All of the lawsuits that led to these injunctions are still continuing to make their way through the courts. The Supreme Court did not make a decision based on the facts and legal rights at issue in these cases, and instead the court allowed the government to implement the rule while the cases continued to be considered by the courts. This new rule redefines public charge and significantly changes how the federal government determines if a person is likely to become a public charge. The new rule will likely make it more difficult for low-income, low-skilled, elderly, or disabled applicants to obtain visas, green cards, or admission into the United States. We will go into more detail on the new public charge regulation from the Department of Homeland Security, but it is important to note at the start of this presentation that this new rule does not apply to all immigrants, and many are exempt from the rule entirely. For example, the public charge rule does not apply in the naturalization process, through which green card holders or lawful permanent residents apply to become U.S. citizens. Even though this rule exempts many immigrants and does not apply to most benefits they use, fear and confusion over the rule has caused many immigrants to avoid a broad range of programs for which they are otherwise eligible. Now let's see who is affected by the new rule. All applicants for admission to the United States or adjustment of status are subject to the public charge rule, unless they are specifically exempted. What does that mean? Well, for starters, adjustment of status is a term used in immigration. It is the process that immigrants can use to apply to become a permanent resident or green card holder when they are already in the United States. In general, the people most affected by the new rule are those seeking a green card or LPR status based on a family relationship. Most who get their green cards in the United States get that based on a petition filed by a U.S. citizen or permanent resident family member. So this is the category of people who are likely to be most impacted by this new rule. But as you can see from this list, there are many, many different immigration statuses that are not subject to this new public charge rule. For refugees, asylees, U visa, T visa, VAWA self-petitioners, and people who apply for those, the U visa, T visa, or VAWA self-petition statuses, are both exempt when they apply for those statuses and when they seek to adjust their status and seek a green card. For people with DACA and TPS, or temporary protected status, they are exempt while they have those statuses, but they may be subject to public charge when seeking green card or LPR status. I'll also note here that green card holders or permanent residents are not subject to this rule, including when they renew their green cards or when they apply for U.S. citizenship through the naturalization process. There are other less common immigration statuses that are also exempt from the rule, and you can find a complete list of those exemptions at the code section listed on this slide. Now let's talk about how the public charge determination process has changed. Public charge itself is now defined as a person who is more likely than not to receive any one of 9 specified public benefits for more than 12 months in the aggregate within any 3-year or 36-month period in the future. The rule itself includes a long list of factors that may be taken into consideration either positively or negatively when determining a person's likelihood of becoming a public charge, or also someone who's more likely than not to receive any one of the 9 specified benefits for more than 12 months in the aggregate or within any 3-year period in the future. Some of the factors that can be considered include things like applicants' age, their health status, their education level, their assets, their financial status, their credit history, and even items like English proficiency and whether they have health insurance. The determination of this public charge is made by an immigration officer who is given broad discretion to weigh all of these various factors. No single factor will determine the outcome of the officer's decision, but some factors are identified by the Department of Homeland Security as being more what's called heavily weighted in the consideration. An example of a heavily weighted negative factor is an applicant who has been diagnosed with a medical condition that is likely to require extensive medical treatment, and the individual does not have health insurance and is unlikely to be able to otherwise have the financial means to pay for those medical costs. So that's seen as what's called, again, a heavily weighted negative factor. And that person is more likely than not to receive one of those 9 specified public benefits for more than 12 months in the aggregate within the next 3-year period. And I will note, we will in the later slides kind of show what those various specified public benefits are. An example of kind of the other side of things, a heavily weighted positive factor is if an applicant's household income, assets, or resources are at least 250% of the federal poverty guidelines. Immigration officers, like I said earlier, do have broad discretion, individual discretion to weigh these various factors and determine the likelihood of an applicant becoming a public charge. Applicants will now be required to submit this information using new forms that also just went into effect yesterday when applying for a green card through adjustment of status. The new form is very long. It's called the I-944. I think it's 18 pages long. It is a significant new burden on the application process. This slide lists the various public benefits that immigration officers may now consider when deciding whether someone is likely to become a public charge. This new rule itself did expand the list of programs that can be considered by immigration officers when determining this public charge test. The first one there you can see is non-emergency federally funded Medicaid. One thing to note on that is that Medicaid received by applicants while under 21, while pregnant, up to 60 days postpartum, and during an emergency are not considered as part of that listed benefit that's included for this public charge test. Number 2 there, it's the Supplemental Nutrition Assistance Program, also known as SNAP, or previously known as food stamps, is included here. Number 3, some federal housing assistance programs. That includes public housing and Section 8 housing assistance, and rental assistance is also included as part of the listed public benefits. For number 4, this is not a change from the previous public benefit test, in that all use of cash aid, including not just TANF and SSI, but also any state or local cash assistance programs, are considered under this public charge rule. So if an applicant has received any of those 9 specified health, nutrition, or housing benefits for more than 12 months in any 36-month period in the past, this does weigh heavily in favor of finding that person to be more likely than not to become a public charge in the future. This is one of those heavily weighted negative factors. But it is important to remember that prior receipt of these benefits is still just one factor in the public charge test to determine if in the future this person is more likely than not to receive any one of those 9 specified public benefits. And I'll also note here is that any benefits received by an immigrants' family members, including their children, are not considered as part of that public charge determination. So we started looking at some of these, benefits that will not be considered as part of that public charge test. On the next 2 slides, we have put together a list of some programs and benefits that fall into this bucket. This is not a comprehensive list. There are many, many more programs that can be considered in this, but it's important to note that any benefit that's not on that specified list we showed earlier is not considered toward this public charge test for the receipt of public benefits. Some of the examples you can see here of programs that will not be considered is, first off, the CHIP program, what's known as FAMIS in Virginia. And that includes both FAMIS for kids and then also FAMIS for pregnant moms, the FAMIS Moms program. That also includes programs like Medicare, it includes the Ryan White HIV/AIDS program, it includes the use of federally qualified health centers. On the next slide here, you'll see it includes the WIC program, and it includes school breakfast and lunch programs, and services through legal aid. All of these are benefits or services or programs that are not considered as part of the public charge test. This slide provides some examples of additional negative factors that are used by immigration officers to determine if in the future a person is more likely than not to receive any one of those 9 specified public benefits. This list of criteria comes from the internal policy guidance on public charge for USCIS. USCIS is one of the divisions of the Department of Homeland Security that's charged with helping to implement this new rule. you can see examples here. Some of the negative factors that are included in this criteria are, being older than 61 years of age, lacking job skills, or having low income. And again, past receipt of any of those 9 public benefits after 2/23/20, so just this past Sunday, is just one of the many factors that's considered as part of the broader test. I'll also note that no health insurance is included as a negative factor. This shows the other side of that test, the positive factors that are considered for the public charge evaluation. And these, if these are observed on an applicant, then it's seen that a person is less likely to receive any of one of those public benefits included in the public charge definition. There we go. Back to the right direction. So health insurance is one of the important factors in this public charge determination. According to this policy guidance, lack of health insurance is considered a negative factor, as you can see on the bottom of this table. And according to the Department of Homeland Security, if an applicant has assets and resources to pay for medical costs, it's actually seen as a positive factor, as this decreases the likelihood that the applicant will become a public charge at any time in the future. And you'll see again, I think we mentioned this earlier, that medical condition, if you have a medical condition with no health insurance or financial resources, that may be seen as a heavily weighted negative factor. For positive factors with respect to health insurance, if you look on the top there, some of the more, what's called those heavily weighted positive factors, it's employer-based health insurance, Medicare, private health insurance that's not subsidized, are all seen as heavily weighted positive factors in the overall test to whether someone will be dependent on the public benefits. You may be surprised to see here that on the bottom for positive factors, so they're not heavily weighted positive factors, but they're still positive factors. You'll see that FAMIS is included, the CHIP program, Medicaid for people under 21, so for kids, and then also Medicaid for pregnant women, including 60 days postpartum. Also included on here is private health insurance through the marketplace, is a positive even with the subsidy. And if you get private health insurance through the marketplace without a subsidy, it's seen as a heavily weighted positive factor. So what does this mean for Virginia and immigrants in Virginia? Well, it's important to note that nearly all immigrants in Virginia are either exempt from the rule or are ineligible for the non-emergency Medicaid benefit included in the public charge definition. Cassie will soon provide an overview of the Medicaid program in Virginia and how immigrants can or qualify for the program. But it's important to note that being uninsured is itself a negative factor and will affect a broad range of immigrants in Virginia. But the good news is that immigrants in Virginia do have many coverage options available to them that are considered by the Department of Homeland Security, including FAMIS, the ACA, or health insurance marketplace coverage, and some of the Medicaid programs as well, as a positive factor in the test to determine if someone is likely to become a public charge in the future. Now that we understand the public charge rule a little bit better, let's turn our attention to the health coverage options that are available in Virginia and how immigrants can qualify for those programs. First, Cassie Edner, a staff attorney with the Legal Services of Northern Virginia, will provide us an overview of the Medicaid program and how immigrants can qualify for that program.
Medicaid is a joint federal and state program that provides free to low-cost comprehensive medical services to low-income individuals. Because it's a dual partnership between the federal and state government, both federal and state laws apply to these programs. In order to qualify for Medicaid, you must meet income and, in some cases, resource requirements. In this webinar, I will be going over covered groups. Covered groups is a term of art that distinguishes different populations who are eligible for different types of Medicaid coverage. Along with the covered groups, individuals must also meet non-financial requirements. For instance, you must be a U.S. citizen or meet non-citizen immigration requirements. There are other requirements that we will not be discussing in this webinar. So first we're going to talk about covered groups. The following covered groups are the covered groups eligible for full Medicaid benefits. The ones that are most commonly referred to are children under the age of 19. This is also named as FAMIS Plus, and as we'll discuss in later slides, should not be thought of as FAMIS because that is a different eligibility requirement. There is also age, blind, and disabled, 80% FPL, federal poverty level, and those are for individuals that are age, blind, and disabled. There's the institutionalized individual covered group and the Medicaid expansion covered group, known as MAGI adults. Other covered groups include low-income families with children, former Virginia foster care children under age 26, IVE foster care or adoption assistance, supplemental security income or SSI, and auxiliary grant recipients. There are also protected covered groups, so individuals that used to receive SSI or used to receive an auxiliary grant that meet certain criteria are also a separate covered group. There's the Breast and Cervical Cancer Prevention and Treatment Act that provides Medicaid benefits to individuals that have been screened and certified as needed breast or cervical treatment from certain federal agencies. There's also the Individuals Under the Age of 21 Special Medical Needs Adoption Assistance. Medicaid is a program that covers an umbrella of different covered groups, and it's really important to understand what type of coverage that you're receiving in order to see whether the public charge would be applicable. We also have limited benefit Medicaid, such as Plan First and Medicare Savings Plans. Plan First only covers family planning services. This includes contraception and STI testing. The Medicare Savings Plans, they cover the Medicare premiums, and in certain instances, such as qualified Medicare beneficiary, that also covers the co-payments, the co-insurance, and the deductible. Last but not least, there's FAMIS and FAMIS Moms. These programs provide low-cost health insurance for children and pregnant women. A lot of people know these programs as CHIP. This FAMIS and FAMIS Mom is just the terminology that we use in Virginia. This program is not considered Medicaid, and in fact, if you go back to the public charge rules, you would see that this is a positive on an application. Real quickly, I'll just go over briefly with the monthly income eligibility limits. Medicaid for children under age 19 and pregnant women. For a family of 3, that income limit is $2,680. For Medicaid for adults age 19 to 64, also known as Medicaid expansion or MAGI adults, that income limit for a family of 3 is $2,499. Then the FAMIS for children under 19 and the FAMIS Moms for pregnant women, along with the Plan First, that income limit is $3,711 for a family of 3. For individuals that are age, blind, and disabled, that income limit for the full Medicaid and not the Medicare savings plan for a family of 2 is $1,150. Like I said, there are different covered groups. These are the main ones, but when you're looking to see whether someone qualifies for Medicaid, you also need to take into account those other covered groups. And of course, these different programs also have different ways on how to calculate the income. And there are certain exceptions and deductions with the different programs. Finally, we're on to the Medicaid immigration rules, the immigrant rules. Immigrants are entitled to full Medicaid benefits or are lawfully residing non-citizen and children under the age of 19 and pregnant women, qualified aliens, immigrants receiving SSI, veterans in active duty military, and certain American Indians. Individuals who are lawfully residing non-citizen children under the age of 19 and pregnant women are an exception to the public charge rule. So those individuals who have health insurance will not be penalized for that. And then also the veterans and active duty military are not included in that rule. So they again can receive those public benefits. However, the immigrants receiving SSI has always been a part of the public charge rule, so there has been no difference there. So what the heck is a qualified alien? A qualified alien includes a bunch of different statuses. There's the lawful permanent residents, the asylees, the refugees, the Afghan or Iraqi immigrants admitted to the U.S. on a special immigrant visa. You have the deportees whose deportation is being withheld under Section 243H or 241B3, the Cuban or Haitian entrants, and the victims of severe form of trafficking. I'd like to point out, again, under the public charge, asylees, refugees, Afghan or Iraqi immigrants admitted to the U.S. on a special immigrant visa, Cuban or Haitian entrants, and victims of severe form of trafficking are an exception to the rule. So individuals under these statuses who have Medicaid, that will not harm them. You have the lawful permanent residents. Again, when you're trying to get your citizenship or when an individual is trying to get their citizenship, it will not take into account the public charge rule. However, if they do leave the country for 6 months, as previously was discussed, and they try to come back, their Medicaid will affect their eligibility to enter the country. And then the deportees whose deportation is being withheld are not an exception or exempt from the public charge rule. So it's important when determining an individual's eligibility to determine what type of qualified alien they are. I'm using the term qualified alien because that's the way it is in the Medicaid manual. If you're a lawful permanent resident, you may be eligible for Medicaid if you've been in the country for 5 years, and you must have worked 40 qualifying quarters or 10 years of work. There's a great appendix in the Medicaid manual that if you need help to determine what that means, that 40 qualifying quarters, it's in Chapter 2, Appendix 3. You can go there. These 5-year requirements and the 40 qualifying quarter requirements, there is an exception for individuals who arrived in the United States before August 22nd, 1996. So again, if you're a lawful permanent resident and you have been in the country prior to August 22nd, 1996, you do not have to meet the 40 qualifying quarter rule or the 5 years in the country as a qualified alien. The governor's budget has taken away the 40 qualifying quarters rule. That the Senate and the House budget also has the 40 qualifying quarters rule removed. So it's likely that come July that this will no longer be a factor in Virginia eligibility, this 40 qualifying quarters. The 5-year requirement is federally required, and it will still be in the eligibility requirements. I just want to briefly touch on the calculating the quarters. You may not have long to have before you have to disregard this. However, just a reminder that when you're calculating quarters, you'll need to take into consideration the quarters earned by the spouse when you were married or while they were married, and also the quarters earned by the parent while the individual was under the age of 18. There's also a lag period. How it usually works is the Department of Social Services or the Department of Family Services evaluates quarters through the State Verification and Exchange System. However, this system has a lag time. So it's important if someone is close to the 40 quarters that you look at these other periods that may be there for that lag time. So for instance, it's an individual submits a tax return. The system might not have been updated because that tax return was submitted over a year ago. So for individuals who are qualified aliens but who are not a lawful permanent resident, they're only eligible for full Medicaid for 7 years. So the refugees, the Eurasians, the asylees, the Afghan or Iraqi special immigrants, the deportees, the Cuban or Haitian entrants, and the victims of severe form of trafficking. Those individuals, after the 7 years, they will no longer be qualified for full Medicaid if they remain in those immigration statuses. For individuals who do not meet the definition of qualified alien or qualified immigrant, and those individuals who aren't pregnant or under the age of 19 and who aren't eligible for full Medicaid may be eligible for emergency Medicaid. Emergency Medicaid covers emergency services to individuals who do not meet the Medicaid immigration status, and it covers things like labor and delivery, dialysis, and accidents. Emergency Medicaid is not full Medicaid, and it does not cover follow-up visits. In order to be eligible for emergency Medicaid, an individual must meet a covered group and that income restriction for that covered group. However, individuals who receive emergency Medicaid will not have this counted against them under the public charge rule.
Thank you, Cassie. Now, Susan Nolan, a healthcare advocacy paralegal also with the Legal Services of Northern Virginia, will take over and give us an overview of the Affordable Care Act and the health insurance marketplace, which we learned earlier is also seen as a positive factor in the public charge rule.
Hello, everyone. You may be wondering, why is the ACA a part of our public charge discussion today? As you may know, the Affordable Care Act, now 10 years old, was designed to extend health care to uninsured Americans and to make health plans more affordable. As Deepak explained, it is not considered a public benefit, but having health insurance is a positive factor under the quote-unquote totality of circumstances review under the new public charge evaluation process. So it is important that immigrants with insurance through the marketplace be aware that they will be asked about it in the screening process and that those questions should not cause alarm. It's a good thing. We also find that sometimes immigrants found not eligible for Medicaid assume they are also not eligible for the marketplace. Marketplace eligibility requirements are much broader than Medicaid's, and there are also special rules for immigrants who can't get Medicaid due to their immigration status. Immigrant awareness of the ACA is low, and because the requirement or mandate to have health insurance is not being enforced as of 2019, we have found that some immigrants think the entire program has ended. What is the marketplace? I know everyone is not familiar with the marketplace, so I'm going to take a few minutes to explain how it works and particularly how it works for immigrants. The marketplace, formerly known as the Federally Facilitated Marketplace, or FFM, is where Virginia residents can shop for comprehensive health plans. Healthcare.gov is the website where you can apply, but it also provides extensive information about the program and how it works. Financial assistance, often called a subsidy, is available for individuals in certain income ranges to help pay for their health plan. Note that you can also elect to shop for plans at the marketplace without a subsidy. This is also part of the public charge review, and marketplace plans without a subsidy are considered to be a heavily weighted positive factor. After submitting an application, an individual's eligibility is immediately determined, either for the marketplace or Medicaid. Consumers can then look at the plans available and see their cost. As you know, open enrollment is only available from November 1 to December 15th at the marketplace, unless you have certain life changes that trigger a special enrollment period, such as loss of coverage from your job, getting married, having a baby, things such as that. Also note that financial assistance is only available if you apply through the marketplace. Basic eligibility requirements for the marketplace are: the individual must be a U.S. citizen or lawfully present in the U.S. for the entire time coverage is sought. They must live in the service area, not be incarcerated. They must have income between 100% and 400% of the federal poverty level to receive financial assistance. This is called a premium tax credit or a subsidy. Note that there is an exception for legally residing immigrants below 100%, and we'll talk about that more in a minute. They also cannot have access to affordable and adequate insurance, as defined on this slide, and typically that's employer coverage or Medicare, things outside the marketplace, and Medicaid. Again, the exception for immigrants is due to their inability to get Medicaid because of their immigration status. They don't have that 40 quarters and 5 years. But we find that when immigrants apply on their own without help, if they don't understand the questions correctly, their answers can cause the system to generate an incorrect result. We have frequently been involved in correcting such errors. Filing a federal tax return is a mandatory requirement. Because these applicants may have very low income, they may not typically file a tax return, so it's important for them to understand this requirement upfront when qualifying for subsidies from the marketplace. Let's take a minute to review current federal poverty guidelines for the marketplace. This may cause confusion because most applicants with income below 138% of the federal poverty level will be referred or determined eligible for Medicaid unless the system recognizes the exception for immigrants and keeps those immigrants in the marketplace. If an immigrant is sent to Medicaid and found not eligible due to their immigration status, they will be referred back to the marketplace under the exception. Any individual or family with income over 138% FPL and up to 400% of the federal poverty level will be found marketplace eligible. In addition to help with premiums, households with income less than 250% FPL, which is $53,325 for a family of 3, are also eligible for cost-sharing reductions when they select silver-level plans, which means they'll receive lower copays and deductibles on those plans. So let's talk about income calculations. While both Medicaid and Marketplace use the Modified Adjusted Gross Income, or MAGI methodology, to assess income eligibility, there are some differences. One of the biggest differences, is that the Marketplace uses projected annual income and Medicaid uses actual monthly income. If an individual's income is too low for the Marketplace and too high for Medicaid, they may have his or her income evaluated under the gap filling rule for Medicaid. Typically, this is for irregular or seasonal workers. Okay, so immigrant eligibility for the marketplace. Don't worry, I'm not going to review this lengthy list of immigrants eligible for the marketplace. I simply want to illustrate the breadth of immigrant types included as eligible to participate in the marketplace. As you can see, all qualified aliens are included, but also note the non-immigrant statuses highlighted in red that are often overlooked by potential applicants. The next slide, 37, spells out that some applicants for certain statuses may also be eligible. And as you know, undocumented and DACA individuals are not eligible for the marketplace or Medicaid. No wrong door. Along with last year's Medicaid expansion, the marketplace became what's called a determination state. What this means is there is no wrong door for applying. If you apply in the marketplace will automatically assess you for Medicaid. If data sources confirm eligibility, you receive an actual Medicaid decision or determination. If not, you will be found assessed eligible and sent directly to Medicaid for further processing. Again, if you apply for Medicaid and are found not eligible, your application will be sent to the marketplace and the applicant must take action to complete that application. Here are a few tips to remember when completing an application. Excuse me. It is important to make sure that names are spelled correctly and that they match both their documents and their Social Security card. Enter the birth dates in the correct format, month, date, year. As you know, other countries do day, month, year. And double check that the alien number is correct. Medicaid and the marketplace both use federal data matching to verify immigration status, and failing to have information entered properly may extend the time it takes to enroll and or trigger verification requirements. Finally, this slide is a reminder of the many healthcare options available in Prince William County, as well as other counties, and to emphasize once more that having health insurance and managing health conditions are positive factors under the new public charge evaluation process. We need to support our immigrant communities by doing what we can to promote a clear and accurate understanding of this aspect of the rule. Thank you.
So I will briefly talk about appeal rights. It's really important based off of this new rule that you make sure that if you're eligible for the marketplace that you can get marketplace health coverage, and just to make sure that your Medicaid is correct. Eligibility appeals, you can appeal both marketplace determinations and Medicaid appeals, but there's different time frames. For Medicaid appeals, you have 30 days to file an appeal, and you can also request an expedited appeal. You can appeal the denial of your application, the effective date of your Medicaid application, actions to terminate, suspend, or reduce benefits, as well as delayed processing of your application. There's also the marketplace appeals, and you can appeal those within 90 days, and you can also request expedited appeals for those. The type of things that you can appeal is whether you're eligible to buy a marketplace plan, whether you qualify for a special enrollment, whether you're eligible for lower costs based on your income, the amount of savings you are eligible for, a reduction in savings that you're eligible for, and whether you are eligible for Medicaid or FAMIS. So if you receive a decision on the marketplace saying that you're not eligible for Medicaid, or if it finds that you are eligible for Medicaid, you can appeal that either to the marketplace or to Medicaid. So on to the next slide. So Susan and I and Deepak are in Northern Virginia to help. Enroll Virginia helps with Medicaid applications and advocacy work, and also Susan also does that. We can help screen eligibility for Medicaid or Marketplace and help explain the rules. We can provide in-person assistance to prepare and file an application, including uploading documentation, or just generally what you're going to need when you submit a Medicaid application or Marketplace application. Susan can help with selecting managed care organizations that meets the need of the applicants and explain how the Medicaid managed care organization program operates. Susan also helps with renewals and getting the paperwork together, letting them know what is necessary for the renewal process. We can review denial of Medicaid or Marketplace for accuracy and possibly appeals. We can Susan and I can help advocate with the Department of Social Services caseworker to resolve discrepancies, and we can also help review any denials of services for accuracy and possible appeals. One of the things that we're seeing right now is the reduction of long-term care hours. We can review those and see whether they might be able to be appealed. And then I just want to thank everyone today.